Assalamu alaikum and welcome back to another episode of What's Up Doc. I'm your host, Dr. Aalia Al-Barwani, and I'm a board-certified family physician. My show, What's Up Doc, is a production of Muslim Network TV, the only Muslim-focused network broadcasting in North America. You can watch us 24/7 on Apple TV, Roku TV, Fire TV, as well as Galaxy Satellite 19. You can watch Muslim Network TV streaming live almost every day on our website at muslimnetwork.tv, as well as our YouTube page at youtube.com/Muslim Network TV. According to the World Health Organization, worldwide, around 50 million people have dementia, and there are nearly 10 million new cases every year. Dementia is one of the major causes of disability and dependency among older people worldwide. And today we're going to be talking about that with our returning guest, Dr. Ali Saad. Dr. Ali Saad graduated from Weill Cornell Medical College in Qatar in 2009. He's board certified in neurology and vascular neurology. Since the pandemic, he's been living in Denver, Colorado, and working part-time with a telemedicine company, as well as local hospitals seeing patients with neurological emergencies. He also created an app called Stroke Trials, which catalogs and analyzes landmark clinical trials focused on stroke. Stroke Trials is available on the App Store and Google Play Store. Welcome, Dr. Saad.
Thank you for having me, Aalia.
Of course, it's such a pleasure to have you back. we couldn't get enough of you the first episode, so we had to have you back for another run.
Mm-hmm. No, I love talking to people about neurological problems. I think it's something that a lot of people have questions about. There's enough good information out there.
Absolutely. And for our topic today, which is dementia, it's, as I mentioned, very common worldwide and even more so in the United States. And we'll get into what dementia is and what it's not and all of those good things. So why don't we start by talking about in the United States, what are the numbers that we're seeing? I mentioned worldwide, as I said, but what are we seeing or what are you seeing in the United States?
So in the US, the last time they looked at Alzheimer's specifically, there are about 4.5 million people living with Alzheimer's in the US alone. And Alzheimer's accounts for about 70% of dementias. So the total number would be higher, but that's approximately how much there was in 2011. And of course, people are living longer now with advances in medical care, being healthier, and people are living well into their 90s, and they're going to be living to their hundreds soon pretty commonly. So we're only going to see that number increase.
Absolutely. And as you mentioned, Alzheimer's and dementia, and I think a lot of the common misconception is that the two are the same, that the form of dementia is Alzheimer's dementia. So let's take a step back and define what dementia is, and then go into where Alzheimer's dementia fits in the picture of dementia.
Sure. So dementia as a category, kind of like headache isn't a specific disease. There are lots of reasons why you can have a headache. Similarly, dementia is a category of disease, and there are multiple types of dementia. Dementia is when you have impairment of your brain functioning so that you can't think and function the way you would normally do. And that's due to either damage of your brain cells or the impairment of your brain cells in communicating with each other. It's distinguished from normal memory loss in that as you get older, it's expected for you to have some mild memory loss, and that you might occasionally forget the name of something or you placed your keys. But dementia is distinguished from that in that in dementia, it does impair your functioning, and you're no longer independent and functioning at the same capacity that you used to. And although memory loss is usually the most common symptom and usually the first symptom in dementia, once the dementia progresses, there'll be other areas of your brain functioning that are involved, and it wouldn't just be memory loss alone.
Thank you for clarifying that. So dementia is more like an umbrella term, just like you said, headaches. And then when we get into the nitty-gritty, there are different causes for dementia. And one of the causes of dementia is Alzheimer's. So it just falls under that umbrella, correct?
Right.
Right. And so because just for general purposes, I guess, let's talk about some other common causes for dementia, because I think if people can relate or understand that as you said, there are different reasons. I know one of the things that I see with dementia is related to vitamin deficiencies, even something as common as that, or even infections can cause some dementia as well. And so if you can go over some of the common things that you see in your practice outside of Alzheimer's that could also be reasons for dementia.
Sure. So when we're thinking about dementia, first of all, we want to make sure it's actually dementia. And we classify memory loss into 3 categories. First, there's the normal memory loss you would expect with aging that everyone's going to have as they get older. The second stage was something called MCI, or mild cognitive impairment. It's an in-between stage between normal memory loss as a part of aging and dementia. And what happens is that your memory loss becomes more noticeable. You may not function in exactly the same way as you did before, but you still remain independent and relatively functional. And just because you have MCI, that doesn't guarantee that you're necessarily going to progress to dementia. If the MCI is an early sign of Alzheimer's, for example, there's a 10% per year rate of conversion from MCI into Alzheimer's. And then, as we said before, the third stage would be dementia, which is when you are no longer independent and have a significant change in the way that you function. And eventually that will involve areas other than just your memory loss. So those are the 3 stages. And like I said, Alzheimer's accounts for about 70% of dementias. When we're talking about dementia, I like to classify it into reversible and non-reversible dementias. So reversible means that someone looks as if they have dementia, their memory is really bad, it's impairing their functioning, but it's not due to something like Alzheimer's. It's something that is that can be almost totally, it can be totally reversed, or at least significantly treated. So the common reasons we'll see for reversible dementia are, number 1, medications. As you get older, you become more sensitive to the side effects of medications, and a lot of the times it happens with really common over-the-counter medications like allergy medicines can do it, blood pressure medicines can do it, antidepressants, sleep medicines. Okay. So one of the first things I'll look for is I'll look through someone's medication list and make sure that there isn't something that's entirely causing their symptoms, or if they have dementia, that the medication might actually be making it worse.
Interesting.
So other than medications, reversible causes would be depression. That depression can look like dementia. If someone's getting poor sleep, their brain is not going to function optimally, and they can have bad memory impairment. As you mentioned, some vitamin deficiencies, like some of the B vitamins, B1, B12, someone can look as if they have dementia. Some hormone problems like thyroid issues can also do it. And then something that I always tell trainees to keep in the back of their mind is something called a subdural hematoma. And that's when you have a very slow bleed in the brain that it usually grows over days to weeks. And then someone will just look like they have dementia that's progressing very rapidly. And that's something where they just drain the blood surgically, and then people are often back to normal.
Okay. Okay. So those were all under the reversible categories, correct?
Mm-hmm.
So
right.
If we were to look at the non-reversible, it'd be Alzheimer's and similar type of neurodegenerative cognitive diseases, correct?
Mm-hmm.
Okay.
Yeah. There would, other than Alzheimer's, which accounts for 70%, there's also Parkinson's disease, Huntington's disease, Lewy body dementia, frontotemporal dementia. Those are all examples. I'd say ones that I see very commonly, especially since my specialty is stroke, is vascular dementia, which is basically having a bunch of silent strokes over the years will eventually get you to the point where your memory becomes impaired. And another condition is something called cerebral amyloid angiopathy. And that's where, rather than having tiny strokes, you have tiny silent bleeds in your brain. And over time, that also accumulates. And it's kind of like Swiss cheese. You have all these tiny little bits of damage to your brain, and eventually there isn't enough healthy brain for you to function the way that you normally would.
Wow, that's fascinating, Dr. Saad. So to recap some of the things that we just went over, you described 2 different things. One was the stages of dementia. You kind of outlined for us normal aging, the memory loss associated with aging, and then there's that gray area called MCI, or mild cognitive impairment, and then we have dementia. And then once we get into dementia, we talked about what are the different causes, Alzheimer's, of course, is at the top of the list with over 70%, but you break it down for us very beautifully into the reversible and non-irreversible causes. So that's really important to keep in mind for patients or anyone who might be suffering or suspicious for symptoms of dementia, that there are so many different causes, and that it's important to talk to your doctor as soon as you're concerned for that diagnosis, to make sure that if it's something reversible, like you said, something as common as depression or over-the-counter medications. Kind of alarming. I didn't know that that it was that common to have for you to see patients that may be contributing to that or making it worse. So now that we have a good understanding and baseline for the different kinds of dementias and baseline, et cetera, what are some of the symptoms? We've already talked, I think, at great length about memory loss being one of the most common things that people come in with, but we know that there is much more happening than just memory loss. So let's talk about some of those signs and symptoms for either an individual to be able to recognize in themselves, if it's early stage, or in family members able to recognize in a loved one.
Yeah, no, that's a great question. And of course, memory loss is the most common and usually the first symptom. But depending on the type of the dementia you have, you may not actually start with memory loss. It could be something else. But regardless of the type of dementia you have, inevitably it will involve at least two areas of your brain functioning, usually memory and something else. So that something else can be several things. You can have mistakes with understanding or expressing language. So people might say something to you and you don't actually understand what those words mean, even though your hearing is totally fine. You might have trouble expressing your language, where you'll make up new words, or you'll substitute words for words that sound similar or have similar meaning. So for example, if you mean to say cat, you might say bat because it sounds similar, or you might substitute pen with pencil because it has a similar function. So you can have manifestations with your language. Other things that can happen, your personality can change. Some people, when they get dementia, they can become more aggressive than they usually were. They might have been very calm people. Others might kind of withdraw into themselves and be more introverted, be quieter, not speak up as much, maybe not be as social. And that's another reason why we need to screen for depression, because it could just be depression, or it could be depression along with dementia, and that's something that's treatable. People can also have inappropriate behavior in public. They might have trouble suppressing urges like wanting to eat, sexual behavior. They might have trouble suppressing that. People can also have trouble with hand-eye coordination in terms of grabbing things in front of them, or having, let's say you have a drawer full of objects. They might have trouble distinguishing a particular object from another. Like if someone opens up a drawer and they're looking for a pen, and there's a bunch of things in that drawer, they might have trouble finding that one thing. And that makes things like driving dangerous.
Wow, that's quite an extensive list beyond what we typically know of, which is memory loss. So there's so much to look for. Are there certain, out of the exhaustive list that you shared with us, are there some symptoms and signs that appear earlier in the dementia process? In this, as we mentioned, there are stages. Is there something that some of them that appear earlier than later, is it a free for all? Can any of them happen at any of those stages in dementia?
It really depends on the type of dementia. Even with Alzheimer's, you can start out with just language problems and have your memory pretty much intact. That's unusual, but we see it. There are other dementias where certain things start before the memory loss. So in Parkinson's, for example, people will have a tremor often before they start to have memory problems. Or in something called Lewy body dementia, they'll have hallucinations before the memory actually starts to deteriorate. So the presenting symptom can actually help us tell what kind of dementia it is sometimes.
Very interesting, Dr. Saad. That's really interesting to know. So essentially, if you're seeing any mix of what you just described and there is some concern, then of course, going to your doctor and talking to them a bit about getting some formal testing, which we can get into once we come back from our first break.
Yep, sounds good.
You're watching What's Up, Doc on Muslim Network TV, and we'll be back after this short break.
A free online chat can give you the personalized tips you need to start boosting your retirement savings today.
Our fellow Americans.
Right now, the COVID-19 vaccines are available to millions of Americans.
And soon, they will be available to everyone.
The science is clear. These vaccines will protect you and those you love from this dangerous and deadly disease.
They could save your life.
So we urge you to get vaccinated when it's available to you.
That's the first step to ending the pandemic and moving our country forward. It's up to you.
Dad, they took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3. Dad! You saved me. Dad?
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
We are Justice for All. Headquartered in the heart of downtown Chicago, Justice for All is a global humanitarian initiative dedicated to raising awareness for human rights concerns impacting vulnerable minority groups. Our diverse team of staff and volunteers, led by Imam Malik Mujahid, work tirelessly to help Justice for All achieve their goals. We promote policies that protect religious freedom, address the root causes of mass displacement, and recognize the plight of refugees and forced migrants. Together, we can continue to stand up for justice. Justice for all.
Find out how to use an awkward silence to help a friend with their mental health at seizetheawkward.org.
Assalamu alaikum and welcome back. Assalamu alaikum and welcome back to What's Up, Doc. Today we are talking about dementia and memory loss. Joining us in that discussion is Dr. Ali Saad. Before the break, Dr. Saad, we were talking about some of the different manifestations, signs, and symptoms of dementia. And as we said, memory loss is one of them, but of course there are other things such as personality changes, trouble with word finding and vocabulary, and even motor or movement issues that you might notice, especially in something like Parkinson's. Now, I know that it's not all about memory loss, but I want to go back to memory loss for just a little bit, because when we talk about memory loss, we know that some of that does come with aging, as we mentioned, and some of it is pathologic or not normal, and so we would be concerned. When we think about that, what can you describe to us what we'd expect to see, in normal aging memory loss versus pathologic? Because sometimes I have families who tell me that my mom, dad could not possibly have dementia because they remember things when they were a child. And so they attribute their good long-term memory to a reason to say that their loved one couldn't possibly have dementia. So I want us to talk a little bit about that so we can give our audience a greater understanding of what we expect and how that memory loss develops over time.
Yeah, no, that's a really good point. There's a couple of things that people will often bring up about their family members that they find reassuring, but as a neurologist, I don't necessarily find reassuring. And that includes retention of long-term memory. People don't usually lose their long-term memory until they're well into their dementia, and they've had it for a number of years and their end stage with their dementia. People usually start out with short-term memory loss. They'll forget, where they just place their keys. They'll have trouble forming new memories, things that happened in the last couple of days, for example. But to lose things like where you went to school, your children's names, recognizing people, that usually tends to happen later.
Okay, so something for our audience to remember is just because they still retain that doesn't mean that they don't have dementia. It may wane over time. Okay. Now we've kind of danced around this, but let's get right into it with Alzheimer's. As we mentioned, it's one of the most leading causes of dementia. And let's talk about what actually is the pathology behind, like, how does it come about? How does Alzheimer's come about to cause dementia? And without getting into too much nerdy detail, but a little bit of understanding for the average patient or person to understand about Alzheimer's.
Yeah, sure. So Alzheimer's disease, there's a lot of reasons that contribute to people developing Alzheimer's. The underlying mechanism is that you get too much production of a protein called amyloid beta, and also of another protein called neurofibrillary tangles, and they're not cleared out of the brain the way they're supposed to. So these are things that people will have in their brain normally, but in Alzheimer's, you have too much of it and it's not cleared out. But the reason why those plaques form and have trouble getting cleared, it really varies. It's a combination of lifestyle choices, but also your genetic predisposition, meaning, what sort of genes you've developed, or what sort of gene mutations you've developed, regardless of whatever family history you have, but then also what tends to run in your family.
Okay, so that's good to know. So a little bit of the science behind it. And you mentioned risk factors. So of course, we know with almost every condition, there's always that genetic predisposition, meaning the genes that you are born with put you at risk for certain conditions. But then we have the nurture piece, which are the lifestyle choices that we make that may make you at higher risk for developing something that may be genetically you may be genetically predisposed to. So when it comes to dementia in general, and maybe if in specific, if there are instances with the different causes for dementia, are there things or risk factors other than genetics that we can do to kind of reduce our risk for developing dementia as we age? Are there things that we can do to reduce our risk in general as well?
Yeah. So the good news about dementia is a lot of it can be prevented, and there's a lot more that people have in their control than out of their control. When you look at Alzheimer's, for example, that's purely due to a genetic cause, meaning you have this mutation and it pretty much guarantees that you're going to get it if your parents had it. That only accounts for 1% of all Alzheimer's. So that's a really low percentage where it's totally heritable. Most Alzheimer's, there's a huge environmental piece, and it's several things. So prevention is key, because once you get to a point where your memory is affected and your functioning is affected, that means that the dementia has been developing over years, and now it's gotten to a point where it's affecting you. And if it's a non-treatable dementia like Alzheimer's, there's nothing that can be done to reverse it. So it's all about prevention. And there are several things that people can do to reduce the risk of developing this. So I talked about that 1% where people have a very strong family history due to a particular gene. But when you look at all the genes that account for Alzheimer's, aside from that one gene, that only accounts for about 10 to 30% of people's risk. So again, a relatively low percentage, meaning the rest of it is environmental. And there are effective prevention measures. So when you're looking at all dementias, Alzheimer's or otherwise, you can get a 28% reduction by just having an active lifestyle. And that's not running a marathon. That's just going for walks, walking to the grocery store rather than taking a car, just
Wow.
getting up and moving around. And when you look at Alzheimer's specifically, it accounts for a 45% reduction, just being physically active.
That is a big number, Dr. Saad. I have to pause and just underline that. That is very impressive. I mean, I know you said that a lot of it is in our control, but 30 to 45% is very high.
Yeah.
So, I mean, we know that exercise is very good for a lot of conditions, and with our mental or with our brain health, to show that that can make such a significant difference. I'm very impressed. Okay, please go on.
Yeah, and there's so many other things. So just normal health screening that you would get with your primary care or your family doctor, looking for things like high blood pressure, diabetes, making sure you're not smoking, making sure you're not drinking a lot. You can reduce your risk of dementia by 33%, because Alzheimer's often exists alongside vascular dementia or dementia due to silent strokes, which are caused by these diseases. Another thing people can do to help reduce the risk of developing dementia is making sure that they're getting screened for depression and treating the depression. So more and more, it's being recommended that for older adults, when they go for their annual visit to their doctor, they get screened for depression, and they're doing it for younger people now too. In addition to remaining physically active, you also have to stay socially active. So having friends and family around you is helpful. The data shows that people that are partnered and in committed long-term relationships have a low risk of dementia. People that have pets, it also seems to help. And then keeping your mind active is also important. So just reading, working as long as you can, even going part-time, just so you're not sitting at home and watching TV, and doing something passive, something where you're thinking and interacting with people and using your brain. And studies also show that people who achieve a higher level of education tend to have a lower risk of dementia. And we're not really sure why that is. Maybe it's because, I don't know that it's because they've made their brain stronger and more resilient, but I wonder if it's because they have gotten to a higher level of education and they've found ways to compensate for their memory loss before it gets to a point that other people start to notice it. Like they might write a bunch of notes for themselves and have little shortcuts to kind of work around it. So it's just conjecture, I'm not sure, but we do know that a higher level of education does correlate with a lower risk of dementia.
Very interesting. So when you talk about keeping your mind mentally active, I get these pop-ups sometimes on my computer. I'm sure you've seen them, for ads for these brain stimulating games, or recommending that you do Sudoku or crossword puzzles. Is there any evidence to support that? Is that the kind of mental stimulation that is required? Or that you're recommending? Okay.
No, not really. So they've studied things like Lumosity, for example.
Yeah, yes, that's the other one. Yes.
Yeah, it makes you better at doing that specific mini game that you're playing. So you get better with that over time, but it doesn't seem to help with dementia specifically. So I kind of think of it like how they'll find or they'll try certain supplements. Like they'll find like this particular vitamin and reducing your stroke risk or your heart attack risk or omega-3s or whatever. And that doesn't have as strong as effect as the entire fish or the entire vegetable. So similarly, you can't just play this mini game. You have to be playing chess with someone, for example. You have to be having a conversation. You need to help with your grandchildren, stay in touch with your friends. So it's really more of a holistic lifestyle approach to remaining physically and socially and cognitively engaged.
Got it. Okay, that's fair, and that makes sense, because you're just like you said, it's more of a wholesome approach. Speaking of that, and speaking of fish, etc., are there specific foods or diets that can help? I know that there are sometimes these gimmicky. I mean, we know that the Mediterranean diet, for example, is really good because it's low and helps. It's a low inflammatory diet. Would something like that be good for someone with dementia? Is there any evidence to support particular eating habits with preventing dementia or helping to kind of keep it from progressing too quickly?
Yeah, so the Mediterranean diet and similar diets where they're emphasizing eating food that's mostly coming from plants and mostly non-processed are good at reducing your risk of silent strokes, which will in turn reduce your risk of dementia. And the Mediterranean diet's been studied specifically and has some evidence showing that it can help with just dementia as a broad category, but it definitely reduces your risk of stroke. So I do recommend a Mediterranean style diet to people, if not to treat them, just treat them for reducing risk of stroke to worsen their dementia. When it comes to specific supplements and vitamins, there's no supplements that's been found to be effective. Things like ginkgo, for example, that hasn't been found to be effective. With vitamins, if you've been diagnosed with Alzheimer's specifically, not just any dementia, it is recommended to take a vitamin E supplement, but the benefit from that is questionable and doesn't have a huge effect. The important thing is that you're not taking huge doses of vitamin E, because that can cause some heart damage in the long term. But just a regular vitamin E supplement of about 2,000 units a day is often recommended by a lot of experts.
And of course, you want each individual patient to, if they want to start something like this, to talk to their family doctor or primary care physician, somebody who knows their history, has a good idea of their other medical issues, because as you mentioned, people with cardiac conditions, it may need to limit how much they're taking. So before we have to take a break in just a little bit. But before this, I just want to say, along these lines, is there a better time to start? And what I mean by that is, after someone has been diagnosed with Parkinson's, Alzheimer's, et cetera, is it too late at that point to make some of the changes that you have mentioned to help prevent dementia? Will it help to reduce the severity of symptoms, or the progression of symptoms rather? Or is it once you've been diagnosed, it's kind of where, there's no real benefit to some of the things you just discussed?
So how quickly your dementia progresses depends on the type of dementia you have. And even when you're talking about a particular type of dementia like Alzheimer's, the underlying reason for your Alzheimer's also affects how quickly you can progress. So some people, they will have a life expectancy of as little as 2 years, whereas others can have a life expectancy of as much as 20 years after a diagnosis of Alzheimer's. So it largely depends on what's causing it. But regardless of when you come in, there are things you can do to reduce the risk of other things contributing to the dementia and making it worse. So you can have more years with good quality of living. So I always encourage people to come in early. Sometimes people will bring in their family members and they're worried that their memory is impaired, and I'll reassure them and say, no, this is just part of normal aging. But we'll often catch people who have early signs of dementia due to Alzheimer's or something else. And there are lifestyle modifications we can implement. We can change things in their environment, which we can talk about later, to reduce the risk of having worsening of symptoms from their dementia, and then having or avoiding things from compounding their dementia.
Okay, excellent. Thank you, Dr. Saad. We will just take a quick break here, and then we'll come back and continue the conversation.
Okay, thank you.
You're watching What's Up, Doc. I'm your host, Dr. Aalia Al-Barwani, and I'll be back after the short break.
A free online chat can give you the personalized tips you need to start boosting your retirement savings today.
Our fellow Americans.
Right now, the COVID-19 vaccines are available to millions of Americans.
And soon, they will be available to everyone.
The science is clear. These vaccines will protect you and those you love from this dangerous and deadly disease.
They could save your life.
So we urge you to get vaccinated when it's available to you.
That's the first step to ending the pandemic and moving our country forward. It's up to you.
Dad, they took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3. You saved me. Dad?
are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
We are Justice for All. Headquartered in the heart of downtown Chicago, Justice for All is a global humanitarian initiative dedicated to raising awareness for human rights concerns impacting vulnerable minority groups. Our diverse team of staff and volunteers, led by Imam Malik Mujahid, work tirelessly to help Justice for All achieve their goals. We promote policies that protect religious freedom, address the root causes of mass displacement, and recognize the plight of refugees and forced migrants. Together, we can continue to stand up for justice. Justice for all.
Find out how to use an awkward silence to help a friend with their mental health at seizetheawkward.org.
Assalamu alaikum and welcome back to What's Up Doc. I'm your host, Dr. Aalia Al-Barwani, and today we're joined by Dr. Ali Saad talking about dementia and memory loss. Dr. Saad, before the break, we were talking about a lot of the different risk factors that contribute to your someone's susceptibility to developing dementia, but also some of the things, and it's very encouraging that you shared a lot of the things that can help prevent dementia are in our hands. It's upwards of 90%, you said. And it's something as simple as exercise. I'm still very impressed by how much of an effect it can have on the progression of disease. Now, generally speaking, we tend to think about dementia as something that affects only our elderly population, but there are a subset of people where this develops at a younger than we would expect, at a younger age than we would expect. So, and we would consider that early onset dementia. Can we talk about, spend a few minutes here just talking about what that is and what that looks like, because it's different from the typical picture we may tend to see or imagine.
Yeah, sure. So early onset Alzheimer's is quite rare. It only accounts for about 1% of all Alzheimer's. And by early onset, that's typically before the age of 60. The average age of onset for early onset Alzheimer's would be around 49, but it can happen anywhere from people's 30s to 50s. And it looks just like Alzheimer's, and it is Alzheimer's. It just happens at an earlier age, and it progresses a lot quicker. And that's the Alzheimer's that people are most worried about when they think about family history, because that's the one where if you have a parent that has it and you inherit that gene from that parent, you're definitely going to get it. So that gives you a 50% chance of inheriting it. So since you're going to get one copy from either parent. But like I said, it is a severe form of Alzheimer's, but that only accounts for 1% of all Alzheimer's. And there's just a few hundred families around the world that actually have this.
Interesting. So if you are at risk due to family history, as Dr. Saad just mentioned, bringing it up with your doctor to talk about what kinds of things that possibly can be done to at least prepare, if nothing else, for the onset. Now, we talked about prevention, diagnosis, symptoms, etc. But how is how is dementia formally diagnosed? We mentioned coming to your doctor for diagnosis, but what do you do as a neurologist when someone comes in with this concern for dementia? What are some of the steps that you take to confirming a diagnosis? Is there imaging involved, blood work? Give us an idea of what to expect.
Yeah. So when you come in with your family member and you're concerned that they might have dementia, the first visit is usually going to be a lot of talking and figuring out when exactly it started and what the possible symptoms might be. So it's going to be also a physical exam with a focus on the neurological aspects of the physical exam. Nothing painful or invasive, really just checking your strength and the feeling on both sides, checking your vision, stuff like that. There's also probably going to be a brief memory screening that's just a page long and takes about 10 minutes to do, where you'll be asked to remember some words, to name some things, do a little bit of math. And that's really going to be the first visit. The doctor's then going to refer you for some blood tests and probably some sort of brain imaging, usually an MRI of the brain, maybe a CAT scan or something else, but an MRI would be the most common thing. And then you'll also possibly be referred for neuropsychological testing. And that's where you're seen by someone who is not a medical doctor, they're a PhD, they're a neuropsychologist, and they'll do a more extensive cognitive battery. So they'll check out your memory in more detail, but that they'll also look at things like your visual spatial skills, your language skills, and just see what part of your brain is affected and put that in the context of your symptoms. Then that'll help your doctor figure out, is this dementia? Is it not? Is it due to depression? If it is dementia, what kind of dementia could this be? And it'll guide further testing.
Absolutely. So it sounds like there's a multi-pronged approach to confirming the diagnosis. As you said, it's important to find out what the underlying cause is, because depending on the cause, if it's reversible, irreversible, etc., the treatment options would be different. So it may be a little bit different now to move into the next step of my question, which is to talk about treatment options, because as we just said, it depends on the causes. But I guess in terms of the general idea of treatment, and maybe specifically for Alzheimer's, since it's one of the most common causes, can we talk a little bit about what are the treatment options that are currently available for patients who are diagnosed? Because a lot of people think that this is, as you mentioned, a death sentence, because well, not as you mentioned, a death sentence because of a potentially shortened lifespan after the diagnosis is made. And so let's talk about and give our patients a little bit of hope about what is out there for treatment options, and whether this is something that's used for management versus cure, because that's the other part of this is, are we treating this, or are we curing this, or just managing symptoms really?
Yeah. No, I'm sure that's something people are very interested in. And before talking about dementia treatment, I want to bring up again, because it's so important that you go to your doctor if you have certain symptoms, and you might even have to send your family member to the ER with certain symptoms for reversible causes of something that looks like dementia. So I would urge you to call 911 or go to the ER if the progression is very rapid. So usually dementia develops slowly over years. But if someone is totally normal and then they're changing very quickly over the course of days or weeks, that's a reason to go to the ER. If they have a change in their speech, if they have a change in vision on one side, if they have a change in strength or feeling on one side of the body, those are all reasons to go to the ER and make sure you don't have an emergency or something that's treatable and reversible. But when we're talking about you've actually been diagnosed with dementia, probably Alzheimer's, but possibly something else. As you mentioned, in terms of disease-modifying treatment, things that actually change the course of disease and make it, less severe. There's no disease-modifying therapy for any of the dementias, including Alzheimer's. There's no pill that makes it better or makes it go away. But there are treatments that help the symptoms be less severe. And there are a lot of things that we need to be doing for our loved ones to make sure that they're in a safe environment. So talking about pills, for example, you might know people that have dementia and they're on their Alzheimer's pills. And so common pills you might encounter are donepezil, it's also called Aricept, or memantine, it's also called Namenda. And these are commonly prescribed for Alzheimer's. And even though they don't modify the disease course, So that, you take someone who is on the pill and someone who's off the pill, and you look at both patients 10 years down the road, they end up in the same spot. But the medications help people's thinking and make it so that their memory isn't as bad. And I only recommend that people take these medications if they find that it's helping. But if they're experiencing side effects, then I tell them just get off of it completely. It's not going to change where you are in the end. This is just something that it's going to help you think a little bit better, keep you more comfortable. But if it's causing any side effects, just go ahead and stop it. And talk to your doctor first before you do that, of course. And in terms of treatments, or really how to support your loved one when they have dementia, let's break it down into what we should be doing philosophically and practically. So philosophically, people often come in very frustrated, they're scared, both the patient and the family. And it's important to see what's important to the person with dementia. And when they're early on, they'll say, I'm afraid of not being able to do this or that, and making sure that their specific concerns are being addressed and you're focusing on those concerns as priorities.
Absolutely.
Because, you might bring your mother in, for example, and you're concerned about her, being safe in the house and not leaving the stove on, but her greatest concern might be not being able to drive, and she thinks that she's coming to the clinic to have her driver's license taken away, which is not the case. So making sure that the priorities are being taken seriously. You also want to make sure that you're not infantilizing the person with dementia, not making them feel like a child, not making them feel like a burden. They're getting to a point where they're impaired, but they have insight, at least in the beginning, that they're becoming impaired. And so you want to support them and not make them feel like a burden, and help them find a different purpose in their life, because they might not be able to do the same things that made them happy before. So they have to find new things to make them happy. So that's how I like to approach it philosophically, because you want to protect them, but you also don't want to be too paternalistic.
Exactly. Thank you for sharing that. That's an important piece that I think that's the human side of the disease, right? It's not just thinking about, especially as someone, a loved one who might be seeing another someone who's seeing a loved one, go through what they're going through with dementia. As you said, as they tend to lack insight as the disease progresses, it's the caregiver that's usually seeing the effects of dementia. And so they tend to shift and look at the priorities or determine priorities for the patient. But as you mentioned, the patient going through this themselves may have their own priorities that they want to maintain, such as driving. That's a really big one for a lot of patients. So that's really important to remember the human side, and to understand that this patient does have a say in all of this. It's not just the caregiver that wants to dictate the management and the treatment. So that's really important. I know you've got more to share with us, but I wanted to just emphasize that because I find that very important, and unfortunately is missed quite a bit.
Yeah, and of course, the patient and the family, they all want the same thing. They want them to be safe. They want them to be as independent as possible. But how you approach it is very important to maintain that alliance, both between the doctor and the family, but also between the family members and the patient. In terms of practical things we can do, and these are things that we should be doing for older adults in our life, just to make life safer and easier for them, but especially people who have dementia. I'll just outline some bullet points. So one thing that I found helpful for some people is they'll really fluctuate in terms of their dementia. It might be very bad some days, and they might be close to normal other days. And some patients have found it helpful to take a video of themselves when they're lucid and tell themselves, this is what's important to me. You're going to have days when you're confused, but don't be scared. Your daughter is here to take care of you. And just hearing it from themselves is often helpful, rather than having another family member tell them, this is what you want. You told me not to do this before. So having it explained to you by yourself is often helpful, although sometimes people will find that confusing. So I think you have to figure out if that's the right choice for that patient. You want to maintain independence as long as it's possible and as long as it's safe. So sometimes the family will come in and say, we want to take away their driving because we're concerned about it. But that doesn't necessarily have to happen in the beginning. You can just have people drive around their block to a close supermarket nearby and just avoid the highway. So you can do it in baby steps. Another thing is people often ask, well, if they're disoriented, like they don't know where they are or they get the date wrong, should I correct them? And that really depends on how the patient's going to react to that. Some people find it very upsetting. Other people find it comforting. So I think it depends on the person. It also depends how you do it. I don't think there's a black and white answer for what you should be doing. And a lot of the things you can do to help focus around having a safe environment. So really just thinking about when your family member walks into the door, what are the things they do in the house and what are ways they could possibly hurt themselves? So some practical steps would be making sure that if there are any rugs in the house, there are rug grips under them and these rugs can't trip them up. Making sure that they have flat shoes with rubber soles so that they're less likely to slip as well. Having things like bars installed next to the toilet and in the bathtub, having carpeting or some kind of surface to prevent slipping on the stairs is also helpful. You also have to think about hygiene. So people will sometimes forget to clean themselves properly. And that's especially important to women as they get older, and they'll often come in with urinary tract infections when they're older, and when they have dementia, they'll often forget to clean properly. So I'll usually recommend to families with women that have dementia to make sure they have bidets installed in the toilets so that they just press a button and they can easily clean themselves and still maintain their dignity without having someone have to clean for them. Other things, and avoid alcohol altogether if possible, but at least cut down the content and shift it to earlier in the day, because we know that people with dementia tend to get more confused at night, and alcohol will make that worse, but alcohol will also reduce the quality of your sleep. So if you can eliminate it, at least make it less and earlier in the day. Other practical steps, installing an electronic lock on some doors so people don't get confused and wander out of the house in the middle of the night. You also want to make sure they're going to the ear and the eye doctor to make sure that their hearing and their vision is as good as it can be, because if they can't hear or see properly, whatever sort of memory problems they have, they're going to become even more confused if they're mishearing you or they're not seeing things properly. Those are just some of the things that come to mind. Is there anything that you do in your practice that you wanted to ask about, or the things that people have asked you about?
No, I love the list that you just shared with us. You added a lot to what I will tell my patients. Generally speaking, I tend to think about the safety aspect, and then driving comes up quite a bit for my patients. But you outline a lot of things that make sense once you bring it up. You're like, yeah, that, you know, that's something that I, if I were in their position, would be worried about or be thinking about. And especially very importantly, their dignity, right? Understanding they don't enjoy going through this any more than you as a caregiver want to see them going through this. And so understanding that as much as we can give them their dignity and independence to an extent, we should still try to do that. And we've really run out of time, but I really enjoyed this discussion because it's so important. As you said, with technology, the way it's advancing, we're going to all be at that point at some time in our life. We're going to be in that age group that we're talking about today. And so it's important to understand how things can be if we take care and pay attention to some of these things you're discussing today. Before we do wrap up, I want to make sure we've talked about the patient, and rightly so, but for caregivers, very briefly, what kind of support do you give the caregiver? Because I also see a lot of caregiver burnout. As you mentioned, sometimes these patients are wandering out in the middle of the night. They're causing a lot of, not intentionally, obviously, this is a part of their pathology, but their caregivers are sometimes at wit's end about what to do for their loved ones. They need some support themselves. So what do you tell your patients who are coming to you, or the caregivers of these patients that you are seeing?
Yeah, no, that's really important, because those caregivers need to be taking care of themselves before they take care of others, right? So I'll usually give people the Alzheimer's Association website, because they can then find their local chapter depending on where they live. And some people, they'll tell me from the get-go, well, I'm not going to use that because there's no treatment for it. What's the point? And I'll tell them it's not necessarily for treatment. It's for, if you want to use a support group for yourself, you can do that. And if you're someone who doesn't need to go to a support group and talk to other people about your problems, you can at least use that support group to get tips and resources from other people in that support group. So there are practical implications of going to the support group. I also recommend that people reach out to either their local academic center or check out a website called clinicaltrials.gov to look for clinical trials in the area for treatments that can potentially help with dementia. And these don't necessarily have to be experimental medications. They can be meditation, they can be doing exercises, they can be doing memory tests, or just getting an MRI of the brain. And you will often get paid for your time, and that'll help with some of the expenses of taking care of your family member. And lastly, making sure that you take your family member to whichever doctor is treating them for their dementia. Because often people will say, well, there's no treatment, why am I going to come back? And you need to come back so that you get the appropriate support services like physical therapy, occupational therapy, getting a home safety evaluation, having access to respite services where you can have someone come and take care of your family members so you have some time off for yourself. So it's not really just to treat the disease itself, but it's also to make sure that the patient is supported and that you're supported.
Thank you so much, Dr. Saad. I feel like you shared and dropped so many gems with us today on this topic. You've shed quite a bit of light on a topic that a lot of us honestly don't even want to think about, let alone talk about. And so I appreciate your time and your experience in sharing that with us today. We wish you every success in your future career.
Okay, great talking to you today.
All right, thank you.
All right, thanks.
Thank you for joining us in another episode of What's Up, Doc. You can watch this episode along with all of our previous episodes on our YouTube page and on our website at muslimnetwork.tv. I'm your host, Dr. Aalia Al-Barwani, and I'll see you next time on another episode of What's Up, Doc.